Did you know that a serious health condition could be quietly developing in your body, and the very first signs might be visible right on your feet? Most people dismiss these tiny changes as completely normal. But the truth is, the physical effects of high blood sugar can appear on your feet long before you ever get a formal clinical diagnosis. Today, Dr. James Thomas is highlighting 9 early warning signs of diabetes that are far too often overlooked. If you can spot these signs early, you can take action to prevent long-term complications like severe nerve damage, kidney issues, and dangerous infections. Let's dive into the 9 critical warning signs your feet are trying to show you. 1. Tingling and numbness. We've all experienced that feeling of our foot falling asleep after sitting awkwardly. However, if you are frequently experiencing tingling or numbness in your feet without a clear reason, it is not something to ignore. This condition is known as peripheral neuropathy. When your blood sugar levels remain consistently high, it actually begins to damage the protective coating surrounding your nerves, leading to a gradual loss of sensation. 2. Burning sensations at night. If you lie down to sleep and feel an intense burning sensation in your feet, as if they are near an open flame, this is a classic red flag. As nerves become damaged, they begin to misfire. They send chaotic pain and heat signals to your brain, even when there is no external heat source. This uncomfortable burning can severely disrupt your sleep and daily life. 3. Slow healing wounds. If you get a tiny cut, a scrape, or a small blister from your shoes, and notice that it takes weeks to heal, you need to pay attention. High blood sugar narrows your blood vessels, severely restricting circulation. When blood vessels are tight, the vital oxygen and nutrients required for tissue repair simply cannot reach the wound, turning a minor scrape into a high risk for serious infection. 4. Skin discoloration. Take a close look at your ankles and toes. If you notice the skin taking on a reddish, dark, or even a bluish tint, do not brush it off. This discoloration is a visual indicator of poor circulation. It means that the skin in that specific area is not receiving adequate blood flow and is being starved of the nourishment it needs to stay healthy. 5. Chronic heel cracking. Dry skin in the winter is normal, but if your heels are constantly cracked, deeply fissured, and no amount of expensive lotion seems to fix them, it's a warning sign. When diabetes damages the autonomic nerves, the sweat glands in your feet stop functioning correctly. Without that natural moisture, the skin becomes incredibly dry, hard, and prone to severe, painful cracking. 6. Persistent swelling, edema. A little swelling after a long day on your feet is standard. However, consistent and stubborn swelling, especially if you notice deep, lingering indentations after taking off your socks, can be a sign of edema. This often points to early diabetic kidney disease, where your body is struggling to maintain its proper fluid balance due to the stress of high blood sugar. 7. Stabbing or electric shock pain. Sometimes you might feel a sudden, sharp, stabbing pain, or what feels like a jolt of electricity shooting through your foot. Many people mistake this for a simple injury, fatigue, or arthritis. In reality, this is neuropathic pain. It is the direct result of hyperactive, damaged nerves crying out because of high glucose levels in your bloodstream. 8. Consistently cold feet. If your feet feel like blocks of ice, even when you are under a blanket or in a warm room, this could indicate peripheral artery disease, PAD. This means that the blood flow down to your lower extremities has been significantly restricted, preventing warm, oxygen-rich blood from reaching your feet. 9. Absence of leg and foot hair. This is a silent, subtle sign that almost everyone misses. If you look at your calves or toes and realize that the hair has thinned out or stopped growing entirely, it is a major clue. It indicates that your hair follicles are no longer receiving enough blood and oxygen to sustain growth, pointing directly to severe circulatory issues. To protect yourself from these dangerous complications, Dr. James Thomas recommends taking action immediately. Here is what you need to do. Daily habits for better health. Stay active. Commit to a 20 to 30-minute walk every single day to dramatically improve your blood circulation. Diet and hydration. Drink plenty of water and prioritize a fiber-rich diet to help naturally regulate your blood sugar levels. Daily foot checks. Make it a habit to inspect your feet every night before bed. Look closely for any cuts, blisters, or changes in skin color. Take professional action. If you or a loved one are experiencing any of these 9 warning signs, do not wait for the symptoms to get worse. Book an appointment with your healthcare provider and request a simple fasting blood glucose test. Early detection can completely change the trajectory of your health and save you from irreversible complications.